March is Colorectal Cancer Awareness Month. It's a time to shine a light on a disease that, while serious, is often preventable and highly treatable when it's caught early. So joining us today to talk about the importance of this topic is colon and rectal surgeon, Dr. Mercedes Nikzad. She's from Dignity Health. Dr. Nikzad, good morning to you. What an incredible conversation you and I have been having leading up to our interview today. Help us understand why it's so important that we raise awareness about colorectal cancer.
Yeah, well, the simple answer is the numbers are high. Colorectal cancer is the third most common cancer diagnosed in men and women in the U.S., over 150,000 cases a year. And it's estimated this year there'll be about 50,000 deaths related to colorectal cancer. In young adults too, it's the #1 cause of cancer-related death in people aged 20 to 49.
Wow, you know, when you shared that statistic, I just found that so stunning. So let's dive deeper really into this conversation. Risk factors and the warning signs we should be looking for.
So risk factors are going to be a family history, somebody in your family with colon or rectal cancer, certain conditions that affect the colon like Crohn's disease, ulcerative colitis, diets that are high in red meat and processed meat, like deli meats and smoked meats, smoking, alcohol use, and sedentary lifestyle, obesity, diabetes. All of those can increase your chance of developing colorectal cancer.
What about the warning signs and symptoms? What should we be looking out for?
So, unfortunately, a lot of times you don't have any signs or symptoms until it gets to a later stage, which is why screening is so important. But things you do want to look out for are changes in your bowel habits. So persistent constipation, diarrhea, change in the caliber or shape and size of your stool, like my stool looks skinny now. Having pain in your belly, decreased appetite, feeling really tired, and then especially rectal bleeding. Blood from your rectum or in your stool. A lot of times it can be from something that's not as serious as cancer, but it's never normal. So if you have any rectal bleeding, you have to talk to your doctor.
I think also too, intuitively, we know when something's off. We shouldn't ignore it as the bottom line.
Yes, absolutely.
All right, let's talk about the screenings. Who should be screened? What are some of the guidelines?
Yes, everyone should be screened, everyone. The age to start for most people is 45, and that changed in the last 10 years. It used to be 50, but because more and more younger people are being diagnosed, that age has gone down to 45. That might change if you have a family history or Crohn's, ulcerative colitis, that number could go down, but for everyone it should be 45. The gold standard test, so the most recommended way to get screened is with a colonoscopy, which is a procedure that we can look inside the colon. There are other options. A flexible sigmoidoscopy, which is like a mini colonoscopy where you just look at the end of the colon. Certain CAT scans called a CT colonography, or stool tests, the FIT test or Cologuard. Those are options. They have to be done more often. And if they are abnormal, then you need to have a colonoscopy done.
So it is Colorectal Cancer Awareness Month. Call to action. What do you want to say to people who are watching about colorectal cancer?
So everyone should get screened. If you are 45 years old and you've never been screened for colorectal cancer, talk to your doctor about it. Talk to your family about any history of cancer or polyps. If they've had polyps on a previous colonoscopy, that's important to know. And then don't be embarrassed. Nobody wants to talk about their bowel habits or going to the bathroom. It's really uncomfortable, but there are no uncomfortable questions for your doctor. So if you're concerned, or even if you just have questions, talk to your doctor about it.
I'm so glad you said that, because it can be an uncomfortable conversation, but it's better to have that uncomfortable conversation versus developing the cancer.
Definitely.
Right? What a great conversation. Dr. Mercedes Nikzad from Dignity Health. By the way, we'll put all of the information about Dignity Health and this call to action up on our screen right now. Thank you so much for this important conversation.
Thank you for having me.
Appreciate your time.
Thank you.